1 in 4 adults over 65 falls every year. Think about that, 1 in 4. And for many older adults, it does not begin with a dramatic accident, not with a broken bone, not even with obviously weak legs. It begins with something much quieter, a foot that feels half asleep, a calf that tingles when you stand, a strange numb patch that makes the floor feel less certain under you. The part that worries me most is this. Many people respond by staying still and waiting for it to pass. But in some cases, that stillness is exactly what keeps the problem going. https://www.cdc.gov/falls/about/index.html. That is why this video matters. The CDC warns that falls are a major threat to independence in older adults. Mayo Clinic and the National Institutes of Health both note that numbness and tingling in the feet and legs can be linked to nerve problems that affect balance, walking, and coordination. And physical therapy has long used one very simple movement to help wake up the lower legs when circulation gets sluggish and the calf muscles stop doing their job. It is called the ankle pump. Simple name, powerful purpose. www.mayoClinic.org/diseases-conditions/symptoms-causes/SYC-2035-2061 www.nidk.nih.gov/health-information/diabetes/overview/preventing-problems/nerve-damage-neuropathy pmc.ncbi.nlm.nih.gov/articles/PMC4793034/. If you believe calm, honest health advice should reach more seniors before small symptoms turn into big problems, subscribe now. It truly helps this channel reach people who need it. And while you listen, tell me your age and where you are watching from. I always love seeing how many people in their 70s, 80s, and beyond are taking charge of their health. So what is the exercise? Sit in a sturdy chair. Let both feet rest flat on the floor. Sit tall but relaxed. Now slowly lift your toes up toward your shins while your heels stay down. Then gently point your toes away and press the front of your feet downward, almost like you are easing onto a gas pedal. Then back up again. Slow, smooth. No jerking, no forcing, just a steady back and forth glide through the ankles. If one leg feels more numb than the other, still move both if you can. If you need to hold the sides of the chair for support, do that. If you feel pain, stop. But if it feels comfortable, this one small movement can start helping in several ways at once. First, it helps your circulation. Not magically, not dramatically, but mechanically. And sometimes mechanics matter more than magic. Your calf muscles are often called a second heart because they help push blood back upward from your lower legs. Blood in the veins does not love climbing uphill. Gravity keeps pulling it down. So if you sit for a long time, especially in the morning, in the car, after dinner, or through a long TV program, fluid and blood can linger in the lower legs. The ankle pump turns the calf back on, like squeezing a soft tube to get water moving again. That is one reason physical therapy uses this motion so often. Most people make a simple mistake here. They wait until the tingling gets strong, then they stand up too fast, stomp around, and hope the leg wakes up. But that is like trying to fix a slow sink by slamming the faucet. The better move is gentle pumping before you stand, before the hallway walk, before the trip to the bathroom at night, before that first step off the couch. You are not punishing the leg, you are preparing it. Picture this, you have been sitting through church, a card game, or a long phone call with your daughter. You stand up, and for a second, the lower leg feels fuzzy, almost wrapped in cotton. That is when many people panic and grab the nearest table. But if you had spent a short moment doing ankle pumps before standing, the calf would already be awake. Blood would already be moving. The transition from sitting to standing would often feel steadier. Not perfect every time, but steadier. Second, the ankle pump may help because nerves do not like being ignored. When a nerve is irritated, compressed, or undernourished, it may send strange messages. Buzzing, pins and needles, burning, or that odd numb feeling many people describe as it's like I'm wearing socks even when I'm barefoot. Mayo Clinic uses that exact kind of description because it is so common. When you move the ankle gently, you are not only helping blood flow, you are also giving the nerves and surrounding tissues a soft reminder that it is time to communicate again. https://www.mayoClinic.org/diseases-conditions/peripheral-neuropathy/symptoms-causes/SYC-2035-2061. Think of a nerve like a phone line inside a garden hose. If the area around it gets tight, stiff, swollen, or poorly supplied, the message becomes scratchy. The ankle pump is not replacing the phone line. It is reducing some of the static. That is why this movement is often more helpful than people expect. It is small enough not to overwhelm the body, but active enough to interrupt that dead, still, compressed feeling that can build up in the lower legs. And here is another mistake. People assume numbness always means damage that cannot change. That is not true. Sometimes it is damage. Sometimes it is irritation. Sometimes it is position. Sometimes it is swelling. Sometimes it is blood sugar. Sometimes it is the lower back. Sometimes it is a vitamin problem. Sometimes it is circulation. In other words, numbness is a message, not a final verdict. Your job is not to guess. Your job is to listen early and respond wisely. Research from the NIH says peripheral neuropathy. That means damage to nerves outside the brain and spinal cord. Often causes burning, tingling, numbness, pain, or weakness in the feet and legs, and it can affect balance and walking. Symptoms are often worse at night. That matters because many seniors notice the problem most when they are lying in bed or when they first get up after resting. Ankle pumps can be especially useful in those moments because they gently wake the lower leg before the first steps of the night or early morning. https://www.nidk.nih.gov/health-information/diabetes/overview/preventing-problems/nerve-damage-diabetic-neuropathy. Let me ask you something for the comments. Have you ever been told that tingling in your feet is just aging? I have a feeling half of you will say yes immediately, and the other half will strongly disagree. Tell me below, because this is a debate older adults need to have more openly. Third, this exercise helps your balance because sensation and balance are teammates. When your feet cannot clearly report what they feel, your brain has to guess more than it should. Is the floor hard or soft? Is your weight forward or back? Did your heel land fully or only halfway? Signal from the foot is blurry. The brain becomes like a driver using a fogged up windshield. You may still get where you need to go, but the trip is shakier. Mayo Clinic and NIH both note that numbness and loss of sensation can lead to coordination problems and falling. www.mayoclinic.org/diseases-conditions/peripheral-neuropathy/symptoms-causes/SYC SYC-2035-2061
www.nidda.nih.gov/health-information/diabetes/overview/preventing-neuropathy/nerve-neuropathy. The mistake here is thinking balance starts in the hips alone. Yes, strong hips matter, but your feet are your landing gear. If the landing gear cannot feel the runway, the whole system feels less safe. Ankle pumps are not a full balance program, let me be honest about that. But they are a very smart first step because they wake up the exact area that touches the ground. Imagine stepping out of bed at 3 a.m. The room is dim. You are thinking about the bathroom, not about your feet. If the feet feel dull and the ankles feel stiff, your first few steps can be uncertain. But if you sit on the edge of the bed and do a few calm ankle pumps first, you are giving your brain a preview. You are saying, here are the feet, here are the ankles, here is where we are in space. That tiny preview can reduce that awful first step surprise. Fourth, this movement breaks the sitting trap, and for many older adults, that matters more than they realize. Sitting itself is not the enemy. Sitting too long without interrupting it is the problem. When you stay in one position, muscles stop contracting, joints stiffen, and tissues around the ankle can feel sticky, almost like a hinge that has not been opened in a while. Then you stand and ask that hinge to suddenly work smoothly. No wonder the leg complains. The ankle pump is like opening and closing a rusty gate before you ask it to swing wide. It is a rehearsal, a warm-up, a wake-up call. And because it is done seated, it is far less intimidating than telling someone with tingling to take a walk when they already feel unsure. This is one reason simple movement matters. It lowers the barrier. It gives you a place to start. Let me show you how to make the exercise work better. Do not rush it. Fast is not better. Harder is not better. Bigger is not always better. Smooth is better. Gentle is better. Consistent is better. Breathe while you do it. Let the ankles move in a comfortable range. If the toes barely move at first, that is okay. A rusty door does not swing wide on the first try. The body often responds to patience faster than it responds to force. Some people also make the mistake of pointing only from the toes. That turns the exercise into a foot wiggle instead of an ankle movement. You want the ankle joint to glide. Think about the whole foot moving, not just the little toes curling. Another mistake is clenching the shoulders, holding the breath, tightening the jaw. That tells me the body is bracing instead of cooperating. Relax your face. Relax your hands. Let the lower leg do the work. And here is one more mistake that is so common. It almost deserves its own warning. People use the exercise only as an emergency tool. The leg goes numb. So they pump the ankles. The tingling passes. So they stop for the rest of the day. But the better approach is to use it as a routine cue. Before standing, after sitting, during long rides, before bed, after waking, during commercials, while waiting for the kettle to boil. Tiny moments, tiny resets. That is how simple habits become powerful. This is where I want to introduce you to Elaine. Elaine is 74. She told her daughter she was not afraid of pain. She was afraid of losing confidence. That is such an important difference. Her problem was not constant agony. It was that fuzzy, unreliable feeling in her feet when she stood after sitting. She described it like this. It feels like my feet are there, but not fully there. She started avoiding the grocery store because long lines made her legs feel strange. She held the cart harder. She moved more slowly. And inside, she had a bigger fear. What if I fall in public? Elaine's doctor checked her. That part matters. They looked at her medications, they discussed blood sugar, they talked about footwear, they ruled out emergency problems. Then she learned a simple seated ankle pump from a therapist and tied it to moments she was already sitting. Overnight transformation. But after a few weeks, she noticed something meaningful. The first steps felt less shocking, the calves felt less heavy. She felt more prepared. Not cured, prepared.
And sometimes that is the change that gives a person their confidence back. That is the kind of outcome I want you to expect. Improvement, support, more awareness, better transitions, possibly less pooling, less stiffness, less that dead foot feeling after sitting, but not magic. If the numbness comes from significant nerve damage, severe spinal compression, advanced circulation problems, or uncontrolled diabetes, an ankle pump alone is not enough. Helpful does not mean complete. Honest hope is stronger than false hope. And this is the moment where I need to say something very clearly. Leg numbness and tingling are not always harmless. Sometimes they are a sign of a larger issue that needs treatment. Diabetes is one of the most common causes of peripheral neuropathy, and NIH says up to half of people with diabetes may develop this type of nerve damage. High blood sugar can damage the nerves and the tiny blood vessels that feed them. Low vitamin B12, kidney disease, thyroid problems, alcohol misuse, pressure on nerves, and poor blood flow to the legs can also play a role. So if this symptom is new, worsening, or unexplained, do not shrug it off. NIDDK https://www.nidddk.nih.gov/health-information/diabetes/overview/preventing-problems/nerve-damage-damage-neuropathy, Mayo Clinic, https://www.mayo-clinic.org/diseases-conditions/peripheral-neuropathy/symptoms-causes/SYC-2031. Harvard Health, https://www.health.harvard.edu/diseases-and-conditions/peripheral-neuropathy-causes-symptoms-treatment-and prevention. Most people think the question is, what exercise should I do? But sometimes the better question is, why is this happening in the first place? If you only treat the sensation and ignore the cause, that is like silencing a smoke alarm without checking the kitchen. The ankle pump can help, but if the stove is still on, you still need to deal with the fire. If you have diabetes, this is especially important. NIH recommends regular foot checks and medical exams because reduced feeling in the feet can make it easier to miss sores, blisters, or injuries. And if the numbness is affecting how you walk, that is not a small issue. That is your independence asking for attention. Bring it up at your next visit. If you have never had your feet checked carefully, ask. Some of you will completely agree with that. Others may say doctors should already be doing it routinely. Tell me in the comments, do you think numb feet in older adults are taken seriously enough? Or do they get brushed aside too often? Now let me give you the red flags because every senior needs to know them. If numbness comes on suddenly, especially on one side of the body, or it is paired with facial drooping, arm weakness, trouble speaking, or confusion, that is not an ankle pump moment. That is a call 911 moment. Stroke is an emergency. Also get prompt medical help if the leg becomes suddenly weak, cold, pale, severely painful, or if you lose control of bladder or bowel function with back symptoms. Do not wait that out at home. www.stroke.nih.gov/materials/no-stroke-actin.htm. www.cdc.gov/stroke/signs-symptoms/index.html. For everyone else, especially those whose symptoms show up after sitting or lying down, this exercise is useful because it is gentle enough to do even on lower energy days. The National Institute on Aging says physical activity is an important part of healthy aging, And the CDC reminds older adults that some physical activity is better than none. I love that line because it removes the pressure. You do not need to become an athlete to help your legs. You need a doorway into movement. For many people, ankle pumps are that doorway.
https://www.nia.nih.gov/health/exercise-and-physical-activity. CDC https://www.cdc.gov/physical-activity-basics/guidelines/older-adults.html.
Think about the psychology of this. A walk may feel overwhelming if your feet are tingling. A balance routine may feel intimidating if you are afraid of falling. But a seated ankle pump? That feels possible. And when something feels possible, you are more likely to actually do it. The best exercise is not always the fanciest one. It is the one your body tolerates and your routine accepts. You can even use it as a signal to check in with yourself. Are both legs the same, or is one side clearly different? Does the tingling improve with motion, or stay exactly the same? Does it show up mostly after sitting, mostly at night, or mostly when walking? Is there burning, cramping, or weakness too? These little observations help your doctor far more than simply saying, "My legs feel weird sometimes." Specific patterns tell stories. If your numbness tends to begin in the low back and travel down one leg, especially with shooting pain, the story may be different. That can suggest irritation coming from the spine. The ankle pump may still feel good because it gets you moving gently, but it is probably not the whole answer. If your symptoms come with calf pain when walking that eases with rest, that can point more towards circulation issues. Again, the exercise may support you, but it should not replace a proper evaluation. One symptom, many possible routes. And let's talk about shoes for a moment, because this part is often overlooked. If your feet are numb, loose slippers and worn-out soles can make you feel even less connected to the floor. A firm, well-fitting shoe can give your foot a better message to work with, the way a good pen gives clearer handwriting. It does not fix the nerve, but it reduces the noise around the nerve. Pairing better footwear with ankle pumps is often smarter than doing either one alone. Another practical tip is to look at your feet. Really look. If sensation is reduced, small problems can hide. A pebble in the shoe, a rubbing seam, a blister you never felt. Mayo Clinic and NIH both warn that numb feet can be injured more easily because you may not notice heat, pressure, or small wounds. If you have diabetes, this is even more important. The goal is not fear, the goal is awareness. www.mayoClinic.org/diseases-peripheral-neuropathy/symptoms-causes/SYC-2065-2061 www.nidk.nih.gov/health-information/diabetes/overview/preventing-problems/nerve-damage-diabetic-neuropathy. Let me ask one more easy question for the comments. When is your numbness or tingling worst? Morning, nighttime, after sitting, or while walking? I read these comments carefully, and the pattern differences are fascinating. Here is something else I want you to remember. Symptoms that involve the legs often frighten people because they feel like a threat to independence. And that fear makes sense. When the legs feel unreliable, the world feels bigger and riskier. But fear also tends to make the body freeze. You move less, you test less, you trust yourself less. The ankle pump helps not only because of what it does in the leg, but because of what it says to the brain. We are not helpless here. We can do something right now. That is powerful. Not because it is dramatic, because it is repeatable. So let's bring it all together. If you are dealing with leg numbness or tingling, especially after rest, this one simple exercise matters for several reasons. It gets the calf pump working, so blood is less likely to pool in the lower leg. It gives nerves and surrounding tissues a gentle wake-up signal instead of leaving them in a stiff, quiet position.
It prepares your feet and ankles before standing, which can make those first steps feel more secure. And it is easy enough to use throughout the day, which means it has a real chance of becoming a habit instead of a one-time attempt. The common mistakes are just as important to remember. Do not wait until symptoms are severe before using it. Do not rush it. Do not point only from the toes. Do not treat it like a cure-all. And do not assume numbness is just age. If you have diabetes, nerve damage is common and deserves attention. If the cause is something like low B12, kidney trouble, thyroid disease, a spine problem, or reduced blood flow, the real progress comes from finding and treating that cause. And if you remember nothing else from today, remember this simple picture. Your calves are pumps, your ankles are hinges, your nerves are messengers. When you sit too long, the pump slows, the hinge stiffens, and the messenger gets noisy. The ankle pump helps all three. It nudges the pump, it opens the hinge, it calms the messenger. That is why something so small can feel surprisingly helpful. I also want to leave you with a realistic kind of hope. Not the kind that says every symptom disappears, the kind that says you may be able to feel more prepared, move with more confidence, and reduce some of the everyday discomfort that makes you hesitate. Stabilization matters. Slowing progression matters. Better first steps matter. Feeling less afraid of standing up matters. These are not small wins. For older adults, these are life wins. Please talk to your doctor before making major changes, especially if you take medication or have a diagnosed condition like diabetes, kidney disease, circulation problems, or a spinal issue. Natural does not always mean risk-free, and if an exercise causes pain, dizziness, or worsening symptoms, stop and get advice. This video is for educational purposes only. If this kind of practical, honest health guidance speaks to you, subscribe now. Every new subscriber helps this channel reach more older adults who need clear answers without fear and without hype. And if you want to keep protecting your legs, your balance, and your independence, watch the next video on the hidden nighttime habits that quietly increase fall risk after age 70. That one could change the way you move through your home tonight.